How is comparative effectiveness research used in managed care?
I think that there's a lot of variability between organizations and even within organizations on how comparative effectiveness is used. I think the big areas are the obvious areas of medical policy and in pharmacy decision making. And I think there is a lot of variability from one organization to another as to how they utilize that information. But again, it's used in large part to try to better understand the population impacted by their decisions and hopefully to customize policy to be much more applicable to their own population.
Why should payers care about CER?
I think that the big reason for payers to care about CER is very much based upon the reality that the clinical trial itself often can't tell them enough about what to expect in terms of both positive and negative potential outcomes in the population that's impacted by their decisions. So comparative effectiveness by design is meant to give us a much broader look and an understanding of what kind of outcomes we can expect on different populations that may not be studied in a clinical trial setting.
What are some of the barriers to members and health plans seeing improved quality and more affordability?
So some of the barriers, I think, to seeing better outcomes and improved affordability for our members is a lot based upon the challenges we all have in trying to get information, not just good information generated, but that information into the hands of both the member and the provider so that they can make the best decisions. I think it is one reason why we see such a long time from when evidence is generated to it's actually incorporated in practice. And I think that's our biggest challenge. And I hope that a lot of what we're doing around comparative effectiveness is not just about doing a better job in generating that evidence, but also at the same time finding good ways to get that information to them so they can make the best decisions.